Welcome everyone to today's webinar on mentally safe environments for BIPOC engagement. With us today is Edward Woods III, Executive Director for the Michigan Independent Citizens Redistricting Commission. Just a few housekeeping things before we get started. Please drop your name in the chat if you need MICRC credits. After this webinar today, I will send you a link for a survey, and once it's completed, I will get a MICRC certificate out to you. This session is being recorded, and you are welcome to drop questions in the chat, and they will be addressed at the end. Right now, I would like to introduce you to Mr. Woods. As the Executive Director for the Michigan Independent Citizens Redistricting Commission, Edward leads the Commission's efforts in documenting its work, identifying lessons learned, facilitating the audit, and representing the Commission. Previously, Edward served as the Communications and Outreach Director for the Commission, and in that role, he collaborated with state organizations and garnered nearly 30,000 public comments for the Commission to fulfill its mission to draw fair maps with citizen input. Being a lifelong Michigander, Edward has extensive experience working for governments and nonprofits and senior leadership, communications, and professional development positions. As a two-time elected nonpartisan official and advocate, Edward enjoys this unique opportunity to explain BIPOC engagement and mentally safe environments. Welcome, Edward.
Thank you so much, Kristen. Ladies and gentlemen, it's good to be here. It's good to see the crowd. I want to have an interactive discussion. If you don't want to show your face, that's fine. But Tim, thank you for showing your face and doing that. But it's always good to see a crowd. You know, during this virtual experience of COVID, we saw names, but not a lot of faces. So if there's a chance, any remote chance that we can see faces, that would be great. We have about an hour for this interactive discussion. We will be doing breakout groups, and we have a couple of polls that you want to do. And I'll be also sharing some personal experiences with regards to this so that you can understand it from my perspective as well and have a little bit of background about me. So I want to thank Laura and Nikki and Christy for showing your beautiful faces and smiles. Greatly appreciate it. Nikki, it seems like you got a great backdrop back there. So it's just nice to see the window. And Bisma, thank you for joining us as well. Oh, hi, Sydney. How are you? Oh, great, great. And hi to Flint Recast, Amanda, to Witherspoon, Morgan, to Jill, to Sophia, to Grace, to Taylor, to Jake, and to Courtney. All right, all right, all right. This is just initial poll. So we're going to just go ahead and just do this initial poll right now, and we're going to launch that. And if you can answer the questions, that would be great. If you can answer the questions, that would be great to this poll. We're going to keep it open for about 2 minutes. But if you can answer to the questions, do you see it? Do you see it? Do you see the poll? Okay, great. If you can answer those questions, that would be great. 18 seconds has elapsed, so it's not that long. But if you can do that, that would be great. Okay, I promise you there's no, just go for it. Let's go for it. This is anonymous, so I do not know who answered what questions. So just go for it. Just want to have just a little dialogue and just kind of see where we are. The first question says, what are the annual costs for depression and anxiety to the global economy? That's the first one. The second question, what does BIPOC mean? The third one, select which statements represent the top 4 predictions about workforce mental health in 2023. And the fourth one, yes or no? Oh, okay, great. I see 13. And we have 18 participants, so we're a few short. So we're gonna let some of you who may not have a chance to respond. We have 15, we just need one more person, and then we can go for it, Hi, Morgan, how are you? Thanks for showing your face, thank you so much. All right, we got 16 out of 16, great, let's take a look. What are the annual costs for depression and anxiety to the global economy? 4 said 1 billion, 8 said 100 billion, 2 said 500 billion, and 1 said 1 trillion. The actual answer are the 2 that said 1 trillion. 1 trillion. And Kristen's going to mail you out a document that talks about this document that will talk about this. What does BIPOC mean? Those that answered Black, Indigenous, people of color are correct. There was 14 that did that very well. 3, select which statements represent the top 4 predictions about workforce mental health in 2023. Employees will expect to own their own schedules. Complex mental health needs will lose some stigma. Supporting employees will mean supporting their families, and employers will focus on equipping managers, let me get it all the way open, to help employees thrive. The actual thing is all 4 are the top 4 workforce predictions for 2023, all 4. And then last but not least, this was just a generic question, yes or no, I'm willing to take what I learned, and you said yes. So thank you very much. Look in your mailbox after the meeting, and Kristen will share with you this document. I couldn't cover everything within the hour, but I just wanted to kind of highlight that, and that document will be a resource that you can use in your respective places. Thank you again. I'm going to take the opportunity to share my screen at this time. And if you can see the screen, just nod your head, and that will be very helpful. If you can see my screen as it's loading, and I'm going to assume that you can see it. So I'm moving some stuff around so that I can better see you. Our course description, what we said we're going to talk about today, is in considering the mental health disparities among BIPOC, Black, Indigenous, people of color, this presentation identifies the challenges and opportunities to create mentally safe environments that thrive on inclusion. Organizations can glean tips and resources to use for their professional development opportunities and events implemented by the Michigan Independent Citizens Redistricting Commission. You'll leave with the confidence to increase engagement of Black, Indigenous, people of color in your organization. Just a little bit of the background of the Michigan Independent Citizens Redistricting Commission. In 2018, Michigan voters passed Proposal 2, a ballot initiative for voters and not legislators to take responsibility for nonpartisan redistricting, and created the Michigan Independent Citizens Redistricting Commission. It's comprised of 13 randomly selected Michigan residents that includes 4 Democrats, 5 independents, and 4 Republicans. It's important to note that this is a self-identification. It is not a check and see to see if any of them are registered with a particular party. Excuse me. The MICRC is responsible for redistricting the U.S. Congressional, which means your U.S. representative, Michigan House and Michigan Senate districts. There are 13 congressional districts coming from Michigan. There are 110 Michigan House districts, and there are 38 Michigan Senate districts. Our strategic plan is to lead Michigan's redistricting process to assure Michigan's congressional, state Senate, and state House district lines are drawn fairly in a citizen-led, transparent process meeting constitutional mandates. Our vision was to chart a positive course for elections based on fair maps for Michigan today and for the future. Our core values focused on integrity, respect, transparency, and being purposeful. The way the maps were drawn by the commission focused on 7 things. And the reason why these 7 things are important is you will see how we did engagement and inclusion, increased awareness so that everyone could feel a part of the process. Equal Population and Voting Rights Act, geographically contiguous, communities of interest. Communities of interest represent 3 things. They focus on cultural. As many of you know, we have a huge Middle East population in Dearborn. They focus on economic interests, and they focus on historical. And historical really means the neighborhoods in the particular cities across the country, or just different things that make it a historical remembrance of that particular community. No disproportionate advantage to any political party, no favor or disfavor to an incumbent elected official or candidate, reflect consideration of county, city, and township boundaries, and be reasonably compact. Now, that you know a little bit about the commission, let's talk about mental health. According to the Center for Disease Control and Prevention, mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Once again, I want to stress the importance of mental health. Mental health impacts everyone. It is not something that I would want anyone to suggest is something for males or females, for young or for old. Mental health, I want to repeat again, mental health is something that impacts everyone, and it impacts people differently based upon their life experiences. So just because something may have gone well for you, it may not have gone well for me, or something may have gone well for you and didn't go well for you, and it has gone well for me. People act and react differently, and you don't know people's circumstances just by looking at them. You don't know if someone's a billionaire. You don't know if someone's poor. You can make judgment and you can make assumptions, but you really do not know what people have gone through. And so when we take a look at mental health, when we see what's happening, not just in the workplace, but in society, the trauma and drama of grief. I lost my father in December 9, 2016. And I have to manage my triggers because there's certain things that remind me about my dad, or if I want to pick up the phone, my dad was my biggest cheerleader. I can't pick up the phone and just call and talk to him. The last conversation I had with my dad was actually 2 days before he died. And I was out of town, and I'm like, my phone is ringing. I'm an hour behind because I'm in Alabama, not in Michigan. And it's like my dad, I'm like, Dad, don't you know what time it is? I was so glad. I was like, it said just to be nice. And we talked and we were exchanging about what happened at the convention I was at. And I was telling him, giving him play by play. And the last thing my dad said to me, the last memory I have of my dad is that he loved me. And so I've always carried that with me, even though I still miss my dad. And my name is Edward Woods III. My dad is Edward Woods Jr. My grandfather is Edward Woods Sr. I lost my grandfather in 2014. I lost my dad in 2016. So whatever's going on in my mind, I'm thinking I'm gone in 2018. We're just all gone. And so I'm worried about my wife. I'm worried about my kids. And I'm a mess because I'm up here thinking, creating stuff in my own head that's just not true. But it's like, well, if he died in 14, my grandfather was, let's see, my grandfather died at 94. And so then my dad I'm like, is it my time? I'm like, wow, in terms of the years. It is just crazy triggers. I go to get help. I went to a mental health professional to get help. I am a believer, just so we're clear, but all pastors are not counselors. And I just got to say this honestly with you all. Pastors are great for biblical counseling, but if they're not trained professionals for counselors. And so we just got to be very clear. We're friends, but I am not a licensed therapist. And let's be very, very clear. A licensed therapist is not a bad thing. The stigma. I grew up here in Michigan. I grew up in Orinoco Township that had the highest rate in the county of assisted living facilities. And my parents would constantly warn me, don't make fun of them, don't pick on them, because something could happen and they're not in their right mind and they could react and it could be harmful to you. I mean, they were constantly reminding, be kind, do not make fun, but they're the pranks and the jokes that were done then we're not seeing that now because there's more of an awareness of the emotional, psychological, and social well-being. And so going back to the point about missing my dad, going back to the point where I grew up, mental health is not a joke. It's something that needs to be taken seriously. And it's something that we need to have in our workplace environments. And we can't limit it to a particular age group. Mental health also deals with trauma. I don't know what it's like to be molested. I don't know about pedophilia. I worked for the Michigan Department of Human Services before they combined with community health. And the things that I saw that took place in child welfare, just messed with my mind. I mean, we had a case where a child was missing and we found the child dead in a storage unit, mutilated. I mean, it just messes with my mind. There was an infant. I don't know if the parent got frustrated or postpartum depression. I'm not sure what it is. The child was placed in the microwave and they nuked the child. I mean, these are the type of situations that I want you to have so you understand, well, where is he coming from? You know, what is his background? These are the type of things that kind of shape you. Obviously, being an African-American in America today is another experience that shapes me. It might not be your experience, but it's something mine. And what I'm finding is sometimes I have to suppress who I am, suppress what is taking place in society because the dominant culture and the environment doesn't want to talk about it, or they see it as politics and put a muzzle on it, and we have no conversations, but yet I'm suffering because I don't feel like the environment is safe for me to have a conversation, because then I'm labeled for causing too much trouble, or I'm labeled for stirring up the pot. And although I'm here to be a part of the team and want to be a part of the team, you are not getting my full authentic self because I'm holding back so that I am not labeled in the environment, or I am not being marginalized for opportunities. And as a result, I can't be fully who I am. And that is frustrating in an environment where I could actually give more, but I have to give less so I can go along to get along. But then when something happens that triggers me, I don't know what happened to him today. He just seemed like he had a meltdown. And it's not like I had a meltdown. This stuff has been building because I haven't been able to have a safe environment where I can talk and not feel marginalized or feel that I will be passed over for opportunities because I'm quote unquote not a good fit. And we all know these different types of buzzwords. Let's get back into the presentation. Realities of mental health. More than 1 in 5 US adults live with a mental illness. Over 1 in 5 youth ages 13 to 18, either currently or at some point during their life, have had a serious debilitating mental illness. About 1 in 25 US adults live with a serious mental illness, such as schizophrenia, bipolar disorder, or major depression. Once again, the source of that is the Center for Disease Control and Prevention. Taking something from the Mayo Clinic, the risk factors of mental illness: feeling sad or down, confused thinking or reduced ability to concentrate, significant tiredness, low energy, or problem sleeping, major changes in eating habits, inability to cope with daily problems or stress, withdrawal from friends and activities, problems with alcohol or drug use. Now, how many of you have seen some of those risk factors in other people, or maybe even yourself, just generically speaking? Show me some reactions, thumbs up, thumb downs, put your hand up. You can identify, you see some of those things. I know for me, when my dad died, I mean, I was eating uncontrollably. I had low energy, it was hard to focus, hard to concentrate. I mean, I just felt debilitated. I felt like trapped in a time zone. And the thing is, the whole world is going on around me. You hear the birds chirping, you see the cars going up and down the street, the sun is going up, the sun is going down. Seems like life is going on well for everybody else, but for you, it just seems like you're frozen or you're trapped in time. And these are some of the things, that people happen. People turn to alcohol, unfortunately. Opioid is a big problem here in the Lansing. We're trying to get everybody to have Narcan in their car so they can help people. These are just real issues that people have, and we don't talk about it. There's just a lot of things we don't talk about it, and nobody wants to bring it up because they don't want to be marginalized. And my premise to you is you will never get the full benefit of all your employees and what they have to offer and to contribute to a thriving workforce unless you create a safe, mentally health environment. Jake, I see your hand is up. And Grace, is that a witness or do you have a question? I don't want to.
That would be a witness, sir. Yes.
All right, we love witnesses. Thank you, Jake. How about you, Grace? Witness, thank you. All right. So in terms of the risk factors, so you kind of see what's going into the sad, down, confused. I mean, this is real. I mean, this is something that I can share with you that I experienced. And I think we underestimate grief and relationships. And I'll be honest with you, I had to go back and apologize because I never felt the grief of death until I lost my dad. Yes, I've gone to funerals, I've been supportive, call people, try to be there. But when I lost my dad, I had to go back and apologize to my friends who lost their parents because the grief journey is not just the funeral, it's the support after the funeral. And it doesn't mean it's going to be done in 1 month and we just went on with life. I mean, that you're talking about a significant loss where someone provided for you, clothes, shelter, tuition, just different things. It's not, but it's more the presence. You go home and you're waiting for him to come down the stairs and he's not coming down. You're just waiting for to hear him rustle around. He's not coming around. You're waiting for him to ask you what's going on. And I'm a huge Cowboys fan. I know some of you guys are Lions fans, so mark me down if you have to, but I love the Cowboys. And we're not talking about these things. And so I just want you to know that sometimes people's reaction is bigger than what's happening in the workplace. And we need to consider that sometimes people are going through a divorce. They may have lost a child. They could be a caregiver. I remember my father-in-law is a caregiver to my mother-in-law who has dementia. And that takes a lot out of him because he can't leave. And, you think you have people there to help, your family's going to help, and there's nobody there, so you can at least walk around the block, clear your head. I mean, and then you have to come to work because you're trying to make ends meet and you don't want to say anything because you don't want anyone to think you're slacking off your work production, or you don't want someone to think that you're not being focused. And so you tend to keep it to yourself. And then you get a trigger that reminds you of something else and it explodes in the workplace. And no one's being kind of considerate because one, you haven't shared. And then two, the environment at the workplace is not really mentally safe. And so these are the things that are happening in real life. Real life. And we have to take a look at these risk factors and create this environment so that you and I and others, whether they're members of your organization, or whether they're clients or customers of your organization, or if it's your workplace team, can feel safe in these environments. The National Minority Mental Health Awareness Month is July. As you know, that's why we are here today with regards to that. And as you know, the focus is on BIPOC, but the risk factors, the definition is the same. Whether you're BIPOC or not, it's still the same. And the reason why we have this month in July is to improve access to mental health treatment and services, and public awareness of mental illness are of paramount importance. There's an important need for improved access to care, treatment, and service for those diagnosed with severe and persistent mental health disorders, and improved public awareness of mental illness. And an appropriate month should be recognized as B.B. Moore Campbell National Minority Mental Health Awareness Month to enhance public awareness of mental illness and mental illness among minorities. So as you notice, I started off with mental illness, and now I'm about to transfer to mental illness among minorities, but have started that conversation by sharing my experiences with you. B.B. Moore Campbell, this is really important, has this quote. And if you know the story about B.B. Moore Campbell, you know about the challenges she had with her daughter in Inglewood, California. And she says this quote, "While everyone, all colors, everyone is affected by stigma. No one wants to say, I am not in control of my mind. No one wants to say the person I love is not in control of their mind. But people of color really don't want to say it because we already feel stigmatized by virtue of skin color or eye shape or accent. And we don't want any more reasons for anyone to say, you're not good enough." Now, that's just real talk. That's just real talk. I mean, I've grown up saying you got to work twice as hard to get one step forward. I mean, you got to do well in school. I mean, it was just beat into me. You got to do well in school. You got to excel. You got to do this. You got to do that so that you could be accepted, so that you could be valued, so that you're not labeled, oh, he must be an affirmative action person, or, oh, he's here because he's a minority and he's not really qualified, or this or that. And so therefore, what she's basically saying, we already don't feel good enough because we feel questioned that we're in the environment. But then to take it a step further, we're also dealing with some issues where our mental health is in question. And therefore, that's like a double whammy. And it doesn't make people of color, Black, Indigenous people of color, to feel comfortable in the environment. And we've seen that become more pronounced, and we'll talk a little bit about that with the pandemic, 3 years ago, in terms of what has happened or what has taken place. And so just want to share that with you. If you're looking in the chat, people are commenting. I want to encourage you to look in the chat and to kind of take a look at what people are saying. They're also sharing some resources that you may find helpful as well. So thank you, Sophia, for doing that. All right. I'm going back and forth with the screen, trying to be interactive and engaging. So I hope this is working for you. And I'm not causing you to go crazy, because he'd say, I see his face and I see the PowerPoint. I see his face. Is he okay? I'm fine. I'm normal. Just having more of an engagement with you in this virtual space. You'll find this one helpful, and you can get this slide. It was created by the Substance Abuse and Mental Health Services. And actually, I will send that slide, to this slide in particular, to Kristen, and Kristen can share this with you along with the document that I used for the quiz, the polling earlier today. And it's basically saying the National Minority Mental Health Awareness Month is saying better mental health through better understanding. And I just really kind of want to focus on this. People from racial and ethnic minority groups often face obstacles in accessing mental health care, including lack of or insufficient health insurance, lack of racial and ethnic diversity among mental health care providers, lack of culturally competent providers, financial strain, and stigma. According to a 2021 Substance Abuse and Mental Health Services survey, Asian, Hispanic, or Latino and Black or African American adults with a mental illness reported receiving mental health services less than white or multiracial adults. So in other words, people of color, BIPOC, are getting mental health services less than white or multiracial adults. In 2021, among adults with any mental illness, the percentage who reported receiving mental health services in the past calendar year, white or multiracial at 52%, Asian 25%, Hispanic or Latino 36%, and Black or African American 39%. So once again, we see the highest groups that are getting it is white or multiracial at 52. Second highest is Black or African American. Third highest is Hispanic or Latino. And fourth is, or the lowest is Asian. So just wanted you to see, what's happening here. And then it's the reason why they talk about better mental health through better understanding. It talks about enhancing the quantity, quality, and diversity of the behavioral health workforce is a key part of ensuring that individuals have access to culturally and linguistically appropriate mental health services. There are several professions under the behavioral health workforce umbrella, each with their own level of education, length of training, and certification requirements. So just kind of wanted to share this with you. Once again, I will share this slide so that you can have it. That came out as a result of July being my National Minority Mental Health Awareness Month. Now that we have this foundation, I'm going to really want to talk about COVID-19 and the pandemic, and talk about what that has happened to BIPOC and how it's been more pronounced as it relates to the need to have a National Minority Mental Health Awareness Month. The World Health Organization raised concerns about President Trump referring to COVID-19 or the coronavirus as the Chinese virus or Wuhan virus or Kung flu. It was an increase in discrimination toward Asians and seen as a dog whistle. And this thing that came out talked about all Asians are not a virus. Hispanics are not illegal. Remember the immigration crisis and what was going on. Black people are not threats, with regards to the George Floyd incident, Breonna Taylor, and so many different incidents that happened in 2020. Muslims are not terrorists and Native Americans are not savages. This was the meme that came out, And what's kind of important, what people need to understand is that this is the stigmatization that people feel when they are walking around their communities, when they're out in public. People feel that this is the perception. It might not be your perception, but if they see people in a demographic or a particular group, I hope they don't think I'm a threat. I can remember walking. I grew up in Bering Springs, Michigan, and my wife and I are walking and someone locks the car when they're driving because they're at the stop sign and we're walking by and you're here like, really? I'm not gonna hijack you. I'm out walking. But I mean, you hear the car. I went to school down south and I realized that when I dress like this, I have no problems. But if I'm in a polo shirt or a t-shirt, they're gonna follow me around the store. So those are the type of things that I'm cognizant about because I know I'm an African-American male and it doesn't matter about my education because no one knows, but I have my education. It doesn't matter what job I have because no one knows what job I have. They see an image. They don't see me. They see an image. And these are the challenges. People don't see you. They see an image. And don't think because we showed you the meme that other people don't have images. One of the most forgotten people or demographic in our country are white poor. There's no advocacy and there's no fighting for them. And I can tell you flat out, they get screwed. I mean, I worked at DHS and they need advocates, but they're invisible in society because no one wants to depict white people as poor. And you go to Kentucky, you go down south in some of our rural areas where there's no access to dental care, access to to medical care, and you see the disparities. And to be honest with you, since if you're not aware of it, it will shock you. It will literally shock you. And these are the type of things, Asians are known as the model minority because they don't complain. They go along to get along in the assumptions. But this COVID-19 was how could I say, a dose of reality in terms of how people thought. I mean, they were telling them to go back home. You're killing us Americans. My friends, they were saying, I'm not Chinese, I'm Korean, but they don't know the difference between Chinese, Korean, and Japanese, and they tell them to go back home, go back to your country. You're killing us, you're making us sick. And it's this type of thing that was going on that is real. And they were scared for their own families because all this time they were taught if they assimilated it and make any waves, it wouldn't be any problems. And now the reality is it didn't work. And they were in fear of their own safety because this COVID-19 virus was unknown, people were dying, and they needed someone to blame. And so when you see those memes, we talk about that. And I mean, it's interesting. We talk about a dog whistle. And if you haven't had, and I'll get to the dog whistle, but one of the good things for me from this whole systemic, when we say the pandemic, we were talking about, the three things was talking about health disparities, was talking about systemic racism and economic uncertainty in terms of the pandemic. I was at the Capitol, and I'm gonna be honest with you, it was during COVID, may have COVID, right after the George Floyd incident. I was going with a group, and I was just humbled and honored to be a part of a group that spoke up responsibly. And you can see skin color is not reasonable suspicion. And we were saying Black Lives Matter wasn't at the expense of any other lives. It was just affirming that Black lives matter too. That's all it was saying. It was not saying no one else's lives matter. The assumption was already given. It was just affirming that Black lives matter too. And this at the Capitol, you got a chance to meet. You saw that there was support. And for me, from a mental standpoint, this was refreshing. This was reinvigorating. And it was very encouraging that people of different colors, different ages, different nationalities were united on this principle. And I found that rewarding. Going back to the Dog Whistle Politics is a book by Ian Haney Lopez. And basically what he's saying is a metaphor that pushes us to recognize that modern racial pandering always operates on two levels: inaudible and easily denied in one range, yet stimulating strong reactions in another. So when you hear about exploiting the welfare system, you have a picture of who's committing fraud in the welfare system. You have an image. When it's talking about portraying illegal immigrants, you have an image of someone you feel illegal. You don't know anything about it, but you have an image, going back to the meme. When it talks about targeting terrorists, you have an image, going back to the meme. You have an image. You can't assume everyone is like that, but there's an image. When it talks about criminals as minorities, if you think of gangs, there's an image. Once again, there's an image. And this is the whole thing behind the dog whistle politics. And those images, those memes are hurtful. But once again, it's a play on words and something that has been unfortunately embedded in our culture. The same thing with words also matter when it comes to mental health. And words do matter. I repeat, words do matter. What's hurtful? The mentally ill, psycho, crazy, lunatic, schizophrenic, or bipolar. But when you talk about people first language and you're trying to be sensitive, people with mental health conditions, a person living with schizophrenia or bipolar disorder, or a person living with dementia, or a person living with Alzheimer, we have to understand that words do matter. I don't care what anybody says. Everybody's heard the cliche, sticks and stones can hurt my bones, but words will never hurt me. That is a bold-faced lie. It's just a bold-faced lie. Words hurt and words matter. And if you don't get anything out of today, please understand, words hurt and words matter. Think about your relationships, whether it's your spouse or your children, and the words that they use or what they have said and how they have hurt you and how you had to work through that. It wasn't because they beat you, but the words matter because they mentally impacted you. And just like you are hurt when that happens, others are hurt as well. And, and some people are like, I'm tired of trying to make everybody feel inclusive. I'm tired of feeling like I have to walk on eggshells. Well, guess what, folk? Everybody has something. And that is our reality. Everybody has something that they're dealing with. And if you want to, how could I say, dismiss it by feeling that you have to walk on eggshells, you're going to want people not to dismiss it when they're coming to talk to you. I had a situation, one of my friends from Atlanta, was talking to me how their husband is feeling different, in the workplace culture because there's more people from India and here dealing with technology than there are Americans, and how it's like a reverse and how you have to get adjusted, and they're talking in their own language. So you don't know whether or not they're talking about you or not. And I'm like, well, welcome to the real world, because we were talking English and they had no idea whether we were talking to them or not. So, things are changing. The demographics of this country are changing. And I must tell you, like I tell myself, remind myself, kindness is free. Kindness is free. And if you're kind to people, I'm not going to say everybody's going to be kind back to you, but they can't disrespect your kindness if it's a consistent part of your character. So I really want to stress kindness, really want to stress the words that we use. and just being there for people. And I'm telling you, it will make an exponential difference in your workplace. The problem is we don't want to invest the time because we say the work is so important, but the work can be done better. It could be more inclusive. It could be a best practice when you invest the time in the relationships with your people. And so I can't stress it enough how important it is to do that. And we'll hear this on the slide right now, because now we're going to deal with some best practices as relates to what we can do in the workplace. Workplace culture, increase awareness, give employees access to educational resources. The American Society for Healthcare Human Resources Administration, you could take a mental health test. You know, it's not scientific or anything, but you could just kind of get a sense if you want to share that with your employees. To do that, you could include mental wellness and wellness benefits, encourage a healthy work-life blend, vocalize leadership supports and behavior changes. If there's something going on, whether it's in the company, whether it's outside of the workplace environment, you know, tell them leadership is aware that there's some behavior changes happening, or there are some behavior things going on, and that the leadership is supportive talking about it. I mean, they're not just want to dismiss it, they want to talk about it. Continuously track engagement to keep the pulse of employee morale. Folk, you got to stay in touch with your people. I mean, I'm sorry, but you got to stay in touch with your people and see how they're doing. It's not just saying, hi, how are you doing? Let's get to work. I mean, Maya Angelou will tell you, I'm trying to get the quote right. It's more or less along the items that nobody knows how much you care until you show it to them. And you got to show it to them. It's not a matter of talking. It's about showing how much you care. And that's something that's so important. I mean, face it, a workplace is almost like a family. You know, we don't want to say family because we don't want to talk about inappropriate relationships, which should not happen in the workplace. I get that. I understand that. But there are some family dynamics in a workplace where people need to feel secure. People need to feel valued. They need to feel appreciated. They need to feel how they're contributing to the goals of the workplace and how they're making a difference, and then also be rewarded for it when it comes to an employment appraisals. I mean, I'm a huge fan that you should not be surprised if you're working for me or if I'm working for you, how we're doing. Because if we're talking, we know what's going on. Your employment appraisal should not be a surprise. It should literally not be a surprise, because we're talking, we're communicating, you know what's going on. And if I'm a good supervisor, you should be acing it all along because I'm coaching you along the way. There should be no anxiety about appraisals. I mean, I never understood why we had to have anxiety, because if we're all on the same team, all working for the same goal, it shouldn't be a surprise. You should be invested in my success and having me function at an optimal level. So that's why that workplace and culture is important. And then changing the narrative. I could be honest with you, this right here upset me so much. This got approved this week in Florida. It says Florida teachers are now required to instruct medical students that enslaved people develop skills which in some instances could be applied for their personal benefit. Now, I'm just going to tell you, slavery was the worst thing that ever happened in this country. And to try to change the narrative to suggest that it was helpful is just frustrating to me. I mean, very frustrating. I lit up my church about, we can't let this go. I lit up the leadership about let us go. I talked to some of my friends. I posted something on Facebook. I'm like, this is insane. Insane that we have a government and a state that's going to sanitize slavery and try to make a negative a positive and think that's okay. No, it's not okay. And it's not politics, even though it's being discussed in a political arena. You're talking about taking away the history of a group of people that have built this country at free. And I'm sorry, because this is personal to me, because this is a reflection of me. I'm African American. I could see the same thing with Hispanic. I'm not Hispanic, but I understand the contributions that they have made. And I'm telling you, growing up in Southwest Michigan, we would have no fruits if we didn't have the Hispanics working the market and seasonal farm workers. It would be a wrap. You go to Mackinac Island, you go up north, we had the Hispanics, now we have the Caribbeans. They have them coming in from Jamaica. It would not work. This is what's happening. This is what's happening. And to sit up here and to suggest something like that is not politics. This tells you how the soul of America or the soul of people doing it. And you can't just dismiss it as politics and say, oh, we can't talk about it. This is what people think, but not only do they think it politically, they also think it from a religious standpoint because it's infused some of our religion. And these are the type of things, words, policies that are taking place in society where there's not a safe place to talk about it because speak to me, feel muzzled because this is declared I'm rocking the boat, stirring up trouble. We can't talk about this in the work environment. It's not productive. It's none of our business. It doesn't impact us. That's in Florida. Folk, I am Black every day. It doesn't change. And just because I'm middle class does not mean I cannot relate to those who are lower class or upper class. I can relate. And I can't be removed from my history because it's my history that I'm standing on the foundation of because it makes me who I am today. I'm shaped by those experiences, just like you're shaped by your experiences. So that changing the narrative and being dismissive and not talking about it is very damaging if you want to create a mentally safe environment, very damaging. What we did as a Michigan Independent Citizens Redistricting Commission is we wanted to see when we went out publicly and did something, we said, how can we explain, that says everything's usually at a 6th grade reading level. We also understood that infographics is a better way to communicate, less words, more infographics seems to be it. So we created what we call infographics to kind of communicate what is redistricting. We talked about when it happens every 10 years. We gave a website and a hashtag. We talked about for the first time in Michigan, letting people know it's a new process. It's no longer the legislators, but the citizens are doing it. So we created that. We tried to be inclusive and show diversity about how residents get to draw the maps and let them see their skin tone or color and have a say about which areas should be represented so that people would show up and speak up. So we tried to explain it through an infographic. We tried to explain it through presentations, but we wanted to make sure that our infographics were inclusive. We wanted to make sure that the reading was clear. I determined the wording that we use. We didn't want to, because redistricting in and of itself is already a hard topic anyway. The press struggled mightily in trying to cover it, but we kind of wanted to make it simple so that we could be inclusive and more engaging. We tried to show why people should care and show your chance to make sure that your voice and your community's voice is heard and represented. Tried to show that with the megaphone. To keep your community together, try to show diversity of pictures and different people just to get involved on behalf of your community. Try to talk about it reflects your values, the importance of healthcare and education, public safety and justice. We were trying to use these infographics to be inclusive because what we have seen in the past is that marginalized group people will not participate if they can't see themselves or if they don't feel invited to speak. So that was something that was important to us. Our languages, because of the Voting Rights Act and what has taken place in Michigan, we tried to make sure we had our materials in Arabic, Bengali, English, and Spanish in terms of how we communicated to the public, how we tried to identify groups. We identified 40 statewide groups that could use this information in communicating redistricting so people know what's going on and how they can participate. In our communication, we had sign language, we had translators. So we always had somebody that spoke Arabic, Bengali, English, and Spanish. But if you had a language outside of that, we had translators available so people could ask their questions and do that. We had closed caption. The one resource that I thought was very helpful was Linguistica in the translation. They were a lifesaver. And if you don't have Linguistica, I would, I put it in the chat, I would encourage you to reach out to them. They do a great job. They're reasonably inexpensive in changing your language from English to Spanish or to whatever language you might have that you're serving. And it just made a difference. It made a difference. We also did our maps to Braille. We changed our maps to Braille, and that made a difference. It made a difference. People could actually see the maps and comment. And what we realize is, you know, as an organization, when you're inclusive and when you're engaging and when you're thoughtful and thinking about the broader group of people that can be engaged in the process, it makes a difference. Not only does it make a difference in terms of people engaging in the process, but it also changes the tone of the meeting because people feel that they can be heard. They might not like the results, and that's fine. I get that, I understand that, but it changes the tone of the meeting. It changes the coverage. It changes how people talk about it when you consider what it's like when you're ostracized and marginalized and are unable to participate in the process. It is 1:54 p.m. And so I want to, I have questions, if you guys have questions. And then I know, then there's a kind of a group exercise. I want to kind of split you up in groups. But how much time do we have, Chris? I know you said I could go over a little bit, but what is the drop dead time to make sure?
You're welcome to keep going.
Okay, well, what does everybody have? Can we do 10 minutes over? Will everybody be okay with that?
Yeah, if you need to leave, feel free to, you know, step off, and we will have this meeting recorded.
All right, but I mean, I just want to make sure you get everything. I know we went through a lot, but it's just important to me. Okay, great. What I want to do then is I want to break you guys off into groups. And this is what I want you to kind of talk about, because I think one of the things about learning that's important to me is the opportunity to communicate with the group and to kind of hear different perspectives. You've heard mine, but you can also hear others and you can share yours. So these are the three questions. What steps can I take to better monitor my mental health? How can organizations better meet the mental health needs of their employees, including minorities, or I should say BIPOC? Is there a correlation between diversity, equity, and inclusion programs, DEI, to mental health, and why? Once again, what steps can I take to better monitor mental health? How could organizations better meet the mental health needs of their employees, including minorities, particularly BIPOC, Black, Indigenous, people of color? Is there a correlation between diversity, equity, and inclusion to mental health, and why? All right, I'm going to break you off into groups, and you'll have about 10 minutes, and then we'll come back together and close. One last thing I want to do, and then we will be done. I'm going to just give you some feedback. If you guys can just answer the feedback in there, that would be great. And then I am going to go back and share my screen one last time. And if you have any contact, if you want to get in contact with me or follow up or questions, my contact information is on the screen, All right. First question, did the training match the course description? What was the biggest takeaway? And how would you rate the training session? I'm sure Kristen's going to do something as well, but it's just first impressions are always good just to see how people feel. If there's any questions while you're doing this, I can take them at this time. Otherwise, I want to make sure I honor what I said in terms of being done 10 minutes over. So if there's any questions, I can take it at this time.
I have one. How does your role, how does that correlate to what we're talking about? I guess I'm not understanding, and I'm glad you're doing this, but I don't understand how the redistricting, well, how does that segue into what we just did? Am I asking the question right?
You are asking the question right.
I'm not sure. I'm trying to.
It had a lot to do with engagement. I mean, we have a huge Bengali population that we really just didn't know anything about. We had no.
Because I think of redistricting as, you know, they took Slotkin from me and they gave her to you. You know what I mean? I'm thinking of it that way.
Okay, and we're looking at getting people like communities of interest, people who didn't have a voice before,
Okay,
like a Bengali delegation in Warren. We didn't know we had a Filipino population around Lathrop Village and Southfield, that pockets of different communities across the state, the rural and urban divide, the suburban divide, all of that had to do, at least from our standpoint, is how can we create an environment where people will feel safe to come talk to us
oh,
about how the map should be drawn and how they need to be included and represented. And as you know, this was the first time that this has ever happened. Usually the legislator did it and there wasn't an open and transparent process. It
right,
wasn't all of these public meetings. So as the communications and outreach director, it was my job to find a way to get as many people to talk about redistricting as possible, come to the meetings, submit maps, so that they didn't feel marginalized or ostracized, but they could actually speak up for their community and not worrying it being packed where they had overrepresentation or being cracked where they were underrepresented and didn't have a voice.
okay, great, that's not how I don't know, I guess I got in my head, it was more about the number of people when you redistrict, so thank you for that.
And it is in terms of population, in terms of
Yeah.
equal population, you're right. But because this is a citizen-led process this time,
Yeah,
we now had to think about getting the public to actually comment.
oh,
And
that's
so
great.
that's kind of where this role came in. And I just kind of wanted to share experiences when you're working with your clients, your customers, or what
Yeah.
have you, since mine was the public. This is something that worked for us to get these different groups to speak out that normally did not participate in the redistricting process. And as well, since the communities of interest was the third ranked redistricting criteria, letting them know that they were truly stakeholders and ensuring that their community was kept together.
Well, that's great that you guys are doing that.
So
Thank you.
that's what actually happened in this new redistricting process. And so what I was trying to do, and hopefully I'm making sense, was share some of our experiences in terms of what we did that you might be able to use for your different organizations that might be helpful.
Well, that's great. I had no idea. I remember when it came about, politically, I remember when it came about, but I guess I did not understand the extent of the work that you were doing. I just took it to mean that it was just the numbers kind of a game, and where you put the lines at for Oakland County or wherever.
But and Oakland County was one of our biggest challenges.
Yes, I know.
To be honest,
sometimes feel like an anomaly in my own county. So yeah.
So a huge challenge. We're actually, I was reviewing some tape about that before. So thank you for that. Any other questions anyone may have?
I was just my idle curiosity. So thank you for entertaining me there.
Oh,
well, I appreciate you doing this, Edward. We're so grateful that you were here with us today. I will say, for my own experience, when you talk about mentally safe spaces, for your work, I also lost a parent a few years ago. And so thank you for sharing your experience. And I was able to have a safe space at my job where they literally gave me the whole month off, which you just don't see in a lot of places. And so I was so grateful that I was able to have that experience. And so, I really hang my hat on that at my last job. So does anyone else have any other experiences that they want to quickly share? Just as a quick reminder, the Mental Health Association in Michigan, we do have membership opportunities. If anyone would like to look into that, I will drop a link here in the chat. But we have very inexpensive memberships. So we hope that you check that out. And our next upcoming webinar is with a young lady from Michigan State University. She is an athlete going pro, and her name is Kamaria McDaniel, and she is going to talk about psychological struggles of a collegiate athlete and solutions for improvement, where we are actually live streaming this interview between her and MHAM CEO and President Marianne Huff. We're going to do an interview style where we're talking about her experiences, and then, how can there be tangible solutions for what she experienced in her college career with her mental health issues, and some really fun solutions. So I hope that you can join us for that. Edward, a pleasure to be able to work with you again here with us today. And We hope everyone has a wonderful day, and I will send out those surveys to those that need McBack credits and a general survey to everybody else. So thank you and have a wonderful rest of your day.